evening, listeners, and a warm welcome to Views on Health. On the program today is Dr. Charani Anuradha Abeyweera, consultant in psychiatry at the National Institute of Mental Health. Welcome back to our studios, Doctor. Pleasure to have you with us once again. And for the information of our listeners, the focus tonight is on family dynamics and mental health well-being. It's quite technical. Without any further ado, over to you, Doctor.
Thank you very much. Good evening, and thank you for giving me the opportunity of talking on family dynamics and the mental health well-being. Yes, I think family dynamics, mainly dysfunction or the interaction between families and members in the family, is important in psychiatric issues as well as in general mental health well-being, and that's why I'm glad I can talk on this.
So, Doctor, again, we do see a lot of social issues that people are facing within families, at places of work, even amongst children in school, wherever. And it's become quite a common thing. It's like in the past, like you would catch a cold, it's been common, but today people don't talk so much of having a cold, even if they have it, but they talk of other things that are related to one's mental health. They say that she's stressed out, or I'm stressed out, or I can't handle this, I just don't know what to do, I feel depressed. It goes on like that. So in this situation, which we see so common, we hear of it, we see it, family dynamics, a very nice term there. You say it's partly like the dysfunction within a family. It is common the way we see it as lay people and you see it as a medical professional. And how does one address this?
Yes. So if we try to understand what family dynamics are, so a relationship between two or more people in a family setting, that's the environment that we're talking about. It deals with the patterns of behavior, how we interact with each other, how we communicate, how we support each other emotionally, as well as the other social aspects, and how it affects our mental health. So mental health is whether we are able to function as a citizen or as a person in the community, first thing in the family, and then outside in the country or the world. And so issues can happen, and that's when a dysfunction happens. So the relationship is not smooth, it's not a good dynamic, it's a bad dynamic, and that's when we call it a family dysfunction. So these affect a person who is growing up from childhood towards adulthood, and also when we are adults, how we face the world, how we face our relationships, our social connections, our work, it affects all of that. That's why I thought this is what we are trying to talk about today. How can we dynamics means it's ever changing, so we can change it. We have to understand what's happening, we have to recognize it, and if it is dysfunctional, if it is not a good supportive system, then we should change it within the family.
So Doctor, you used a word in your explanation. We got to understand, but to understand you have to be aware.
Yes.
So how does that happen? I mean, if they're not aware, then that situation can continue.
Yeah. So most of us are not aware of what we do. It's subconscious or unconscious. It's ingrained to us since our early childhood, our behaviors, our behavior patterns, how we interact, communicate. And so if it was myself, like for example, I would have to be aware of my own actions, the way I speak, the way I am either supportive or not supportive of the other member in my family or within a relationship. And how I communicate or not communicate. So if there are issues within the relationship between the family members, we may not communicate properly. So that's poor communication that will also perpetuate all of these issues. And I can observe it in the other person. If that person doesn't want to talk to me, engage with me, or if they are very agitated or irritable towards me and say, I don't like you talking like that, or why are you not talking to me, communication wise, or you're not emotionally supporting me. So it's two ways. You have to respect each other and also identify. Can it be me? Can I be causing this behavior in the other person? Or is that person, am I feel like feeding off of that energy? So that's the kind of awareness we have to gain, because there are lots of, it can impact you in several ways throughout your life. And it also, when we see psychiatric patients, we see a lot of expressed emotions in the family, and that's where the family dynamics also come into play.
A question that I would like to ask you is, if the children in the family, a child or maybe 2 or 3 children or whatever the number, they have issues, or one child has an issue and but not the others, still the parents might be able to recognize that something is wrong here and then try to see how best they can address the situation. The other side of it, doctor, if the parents are having an issue, how does that impact? It will impact on the children, no doubt, but how would they then, it's their behavior that needs to be addressed so that the family can have the peace and harmony it requires?
Yes, that's where self-awareness comes into play. So it's very difficult when a child or an adolescent or a young adult comes to us with a psychiatric illness or a mental health issue. And I wouldn't say a reason, but some of it may stem from the behavior of the parents. And when you talk to the parents and say, some of your behaviors are affecting your child, nobody's ready to listen to that or to accept it. So we have to be very compassionate and empathetic when we're talking about all of these. And very, I would say very professional in that sense. I have to keep my boundaries as a professional and medical professional, and also give the scientific knowledge that I have to make them understand it and be aware.
So a question I should have asked you at the very outset was, how common is this?
Well, I see it a lot in most of the patients who I see in the clinic or in an inpatient setting. I usually see psychotic or mood-affected individuals. And it could be depression, it could be bipolar, it could be schizophrenia, even dementia, and substance use disorders, addictions. The way the family interacts, or the way the child was brought up at a young age, early childhood, formative years, what they have seen throughout the years, what they have. So, like I said, keep saying the early childhood is where we imitate, we see the values of the family, of the adults, and we follow that. So that's vicariously we are learning how to interact in the society, and that's what becomes part of us. And as adults, that would follow through in our relationships and our social interactions. And if a child is not brought up in an emotionally supportive, communicative family, it could affect them. They could become avoidant, they could become antisocial, or if they have genetic predisposition, like family history of psychiatric illnesses, they could fall prey to that. So what happens is, when they are brought to the clinic or the ward setting, families have lots of expressed emotions. They either neglect the person, or they are very hostile, critical of everything they do, not understand that it's part of an illness or part of the behavior between the family members. And sometimes you have to step away and let them be. That's where we have a social worker as well, a psychiatric social worker, and a multidisciplinary team where we address all of this, try to address it.
So obviously communication is so important, and when they come to you, straight away, unless they tell you something, this is what we are going through, or this is what we're experiencing, or this is what we see, you'll have to start from somewhere to analyze the situation. I don't want to use the word diagnose because it's not that
No,
type of ailment. You
yeah.
just have to sit and analyze too. So you need go back to history.
Yes.
And how communicative are your patients? What if they are not communicative? How
Okay.
do you draw them out? Is this tough?
It is tough.
Yes, so
Sometimes it is.
how do you do it? Yeah.
Especially if the family is also there and then you're not able to tell your problems. So confidentiality and privacy is something that we do consider, but sometimes we have to bring the family for family meetings, and we take consent from either parties. Look, what we're discussing here is between us. It's not going to be outside. We resolve as much as we can the conflicts or issues that you bring up, and we'll respect your wishes. If you don't want to talk about it, you can talk about it later. Part of that is also therapeutic alliance, building a therapeutic relationship with the family and the patient or the client, individual, and also trustworthiness. So they have to be trustworthy that we are going to be good professionals, ethical, and keep that confidentiality. So I can't come here and talk about certain issues. It wouldn't be ethical. And I would be breaking confidentiality and privacy of the people who seek help from me. And we see a lot of issues that are very simple, but they have mushroomed into big problems. And when you discuss it in an open forum with the multidisciplinary team or one or two of our members, we can mediate and try to find a common ground, compromise. Maybe it's a misunderstanding and you are able to clear that misunderstanding.
Dr. Interesting that you might have somebody else, another professional along with you if necessary to address the situation.
Yes.
And that helps.
Yes. Usually it would be a psychologist or a psychosocial worker. I have sat in some of these family meetings that are very complex. So you do need a mediator.
So they are with you at the Institute of Mental Health.
Yes.
They are with you there.
We have them.
So you have your team ready.
Yeah.
You need to, you draw on them.
Yeah.
As much as you would assist another colleague if he or she requests you to.
Yes.
That's interesting and important because we have the foundation there then to build on to address the situation.
So in the mental Institute of Mental Health, what happens is we have certain areas. There's something called the Navodaya. It's a clinic-based building, and we have families or individuals who come in for psychotherapy. And in the ward setting or the clinic setting, if we see that there are conflicts or role expectations that are not conducive to a proper family setup or relationship, we'd address that. That's why we have family meetings, and there's also a couple therapy clinic for issues between partners.
Doctor, as do most such issues, could there be extreme situations where they're just desperate, someone is desperate and might do something that he or she shouldn't do?
Yes.
Like we discussed before, inflicting pain on themselves or attempting suicide, or actually committing suicide finally, that also can happen.
Yeah, so if you feel...
Or harming somebody else in the family,
that's
not
true.
necessarily yourself, but you might harm another person.
Yes. So if you feel, for example, if you feel neglected, you're not heard in the family. And if you're also having difficulty in patterns of behavior, in your personality, sometimes avoidant, maybe emotionally unstable, and you feel apart from the whole other family, one child feels neglected, but they're not actually neglected. So that's the emotional component. And then how does the rest of the family interpret that or interact with them? If they can't, and if they're also very expressing so many emotions, like you're not listening to us, or you're a bad child, or you're a bad young adult, you didn't perform to the expected level or standard that we want as a family. And then it could cause anxiety, depression, and like I said, if they're emotionally unstable and there is a personal trait, some of them do vocalize it, some of us as individuals, I should say, try to harm ourselves physically. That's how we get rid of the pain, emotional pain, using physical pain. That could end up in suicide, even though we don't want suicide. It also could lead to depression, all of these issues. And when you're depressed, you may feel suicidal and you may commit suicide. On the other hand, like you said, harming other people in the family. So if a parent or another member is always belittling you, not listening to you, not communicating, and you also can't give your side of what you want in the relationship, you're not getting it and you're not able to communicate it. So there's no respect in that, mutual respect. And there's no conflict resolution. We don't know what the role is for person A and person B. And that's not addressed. Person B may think, okay, this person is harming me, I need to get away. And in that desperation or frustration, unless they're psychotic, even if they're psychotic, it could happen and they could harm the other person.
Does this situation lead to overindulgence in terms of, say, food? Or on the other side of it, not eating, losing appetite, sometimes doing things like outrageous. I don't know, I'm just only
So
asking this because it just crosses my mind.
It's seeking validation. So maybe eating a lot can reduce, so binge eating, it could reduce the anxiety at times. Or it may be filling a void and you feel comfortable when you eat. Rather than trying to seek connections within the family, like talk to someone, talk to your mother or father or your siblings. And the other hand, if you stop eating because you feel criticized or scrutinized, or maybe someone said something about your body image and you have body image issues and you feel, okay, I'm not good enough, so maybe my body is also not looking good enough. If I was like my sibling who is more accepted in the family, then I may be accepted. So it's all validation and acceptance, attention. And sometimes self-harm can also cause more attention to be given to you as a person. And that's when that keeps going on, that pattern continues. On the other hand, isolation and depression, those can also perpetuate like eating disorders such as binge eating or anorexia, that is reducing food intake. And also I should say about post-traumatic stress disorder in abusive relationships or abusive families. That is also part of the dysfunction part of family dynamics, not the healthy family, but an unhealthy dysfunctional family. Some of the children or siblings may have undergone bullying, harassment and trauma. It could be abuse, it could be physical, verbal, emotional, or even sexual abuse. If it's a partnership, it could be financial exploitation also. So all of these do have negative effects, and part of it is post-traumatic stress disorder, which could come up in an interview or a review. Thus,
Yeah, so like any ailment, like we keep saying, it will vary from patient to patient,
yes.
and you have to deal with it accordingly. Would you say, doctor, that this situation can be overcome? Say, take a family, or it may be the entire family, it may be the parents, it may be the children, but you can help them to get over it.
We can try to help them. So sometimes there are families that are ingrained with certain behaviors or traditions or certain ways that they are not ready to change. But then the person who comes to us and says, this is a problem for me, I'm depressed, I'm anxious, I have PTSD features because of this behavior that happened. And then what can I do about it? So one of the things we would say is take care of yourself while you're in that environment. If you can't change the environment, you have to change yourself and try to be less anxious, not take it personally. And it doesn't mean to react and be like, I'm not going to live with you all or anything. We do need family, but we can communicate to someone who is close to us. We can talk about it. We can go for family therapy if needed, and try to discuss and try to handle it. If not, anyway, we have to take care of ourselves. So self-care is important.
Anger management?
Yes, very much. Anger management. It's about understanding and recognizing, recognizing and being aware of the patterns of behavior and how it affects us. Once we understand that, sometimes it may not affect us later on. When we understand that a person A is being vocal or very verbally abusive, is because they're reacting to something in their mind, and they have to speak to us. So we are family. Family will always have conflicts. How do we resolve this in a respectful, emotionally supportive manner? That is the most important thing.
If necessary, do you prescribe any medication to keep a person calm? Or
So the person who comes with an anxiety disorder, depressive disorder, psychotic disorder, or affective disorder like a bipolar affective disorder, or with PTSD, according to the level of dysfunction and their diagnosis, we may have to give them antidepressants or antipsychotics. That is the psychiatric component of it. But family dynamics comes in the social component. So we have a biopsychosocial model of treatment, and that's more psychological and social. For that, you usually don't need medication. It's about talking, recognizing patterns, and also recognizing the transgenerational or the perpetuation of from generation to generation, because that's what we have learned from our elders. It could come down generations, but then someone is like, I don't really like that. That is not how I want my family to be. And you can change it. Yes.
so, Doctor, it was so interesting. Doctor, time is catching up with us. If there's anything else you would like to add, we'd like to hear you.
Yeah, so what I would like to say is family dysfunction can be transgenerational, like I said. So it could come from generation to generation. But if we are aware of our own emotional needs and are respectful in our communication, open, and able to resolve conflicts within a family group or relationship, we should be able to make a dysfunctional or a bad dynamic a good, emotionally supportive dynamic.
Just one question before we wind up. I know it's not a across the board answer, but this type of situation does take time to overcome.
Yes.
Basically, can it go on maybe for a year, 2 years?
It could go on. It could go on lifetime. Like I said, it could be there from childhood. It could be the pattern of behavior that the person or the family is used to. But
so
that is
they're not going to change then?
We don't know. We have to try and discuss it with them. What I would do is I would focus on my patient, and that is when I would focus on the family. And then if the family does understand that they need more help, then we can direct them to certain facilities that will help them.
Thank you, Doctor. And there we end this very interesting discussion on family dynamics and mental health well-being. To Dr. Charani Anuradha Abeyweera, our grateful thanks.
Thank you very much.
Thank you so much. And we hope you can come back to SLBC for some other interesting discussions in the days to come.
Yes. Absolutely.
On the program tonight was Dr. Charani Anuradha Abeyweera, consultant psychiatrist at the National Institute of Mental Health in Sri Lanka. Thank you so much to Doctor for being with us.
Thank you very much.
And my thanks also go to Prabha Veerasurya for technical assistance. I'm Fatima Razi Qaida saying good night and looking forward to your company next Monday, same time on Views on Health.